Hi, everyone. Welcome to Experts Dig In with Doggies for Dementia. I am Carmen DeValis and the founder of Doggies for Dementia Foundation, which is a 501(c) nonprofit. Our mission is to raise awareness and to educate the public about dementia. A big reason why is because it's a very, for families, it can be very lonely and isolating when others don't understand, and we just really want to reduce that stigma for them. And we gift families photo sessions, and together with the family, we share those stories out, those beautiful stories of the families, both the triumphs and the challenges, and share some of the um, really all about what they want us to know about what it's like so that we may have a more kind and compassionate world. And speaking of that, today I have a wonderful guest, Yoli Campos Smith, who is a nurse who's been a nurse for 32 years. So thank you for that. I'm 40 something, so we're good with that. We have a lot of experience here. I think almost 100 years between us, so that's pretty good. Not quite, maybe 70. And we're going to talk about hospice today. And there are so many myths around hospice, and people want to know, what is hospice? Why do I need to know about that? And that's what we're going to talk about. And Yoli Campos Smith is a hospice expert and works for the Wesleyan. And I'm trying to remember your title here, because you may have to help me with that, Yoli, to make sure I get
No
that straight.
problem.
Okay. And
Yeah,
welcome to the program.
thank you so much for inviting me over. And I'm a business development specialist. And like you said, I'm also a nurse. So my job is to go out and talk to people. Just like you said, that everybody talks about these myths with hospice. I think one of the biggest one, first of all, it means that your hospice is a service, and we serve you wherever you call home. That could be your house, could be an assisted living facility, or even a skilled nursing facility. So wherever you call home, it's a service that goes there. It's a service that Medicare pays for. A lot of people think, oh, I can't afford any more care. Well, the truth is Medicare pays for us 100%. So what
I want to say, Yoli, I'll just say that's such an interesting point, because when it comes to dementia care, so much is not covered. Like the long-term care communities, these are not covered by Medicare. Families are paying out of pocket. And hospice, though, is covered.
That is correct. I used to be a case manager in the hospital, and I can't tell you how many families would come to me and says, doesn't Medicare pay for this? They're just overwhelmed. And the truth is Medicare doesn't pay for assisted living or long-term care. But with hospice, you get a whole team, and Medicare covers not only the team, which is your RN, your social worker, your nursing, certified nursing assistant, but all of your equipment and even your briefs and your wipes. You also get a chaplain and a social worker to help with some other area resources. So think of all of that. If you're overwhelmed, you don't even know which direction to go, think of all that extra guidance you get in your home or wherever your patient calls home. That's a lot. That's a lot of help added on to what you already have.
It is. Yeah. What a wonderful service. I think probably talking about death and preparing for death, or even the idea of a good death, is like the last thing we want to talk about.
Exactly. Right? Especially if it's your mom or your grandma or your spouse. I think we as just like yourself, being a nurse practitioner, when you're talking to people, that's something we deal with all the time, correct? But most families, it may be their very first experience. So they don't know what to expect. They don't know what a good death even sounds like, because to them, death is not a good thing. For some people, unfortunately, it is a blessing, because it's been a long road, whatever their disease, especially dementia. It's very hard because you lose that patient early on. they're not the same person. They don't behave the same. They may not recognize you. And even in the latter stages, when we mainly see them, they forget how to eat and swallow. All kinds of things are happening. So we're in there to help guide them with all those new avenues, their new normal is what I like to call it. So some of them.
Oh, I was just going to ask you. Yeah. So what do you think, like the top 3 myths that you hear? Because I know you're talking to families every day, and you're hearing what they have to say back to you, which is eye-opening, because as you said, for those of us that have been in the field, it's a surprise to us sometimes, and it's that's because we're more familiar with it, but most people are not. So
most people are not. It's not dinner conversation is what I like to say that you usually talk about. So most people think hospice is giving up, and that once you put their loved one on hospice, you're going to stop all their medicines. And God forbid they get a cold or something, because, they're not going to get any treatment. That couldn't be further from the truth, because we will give antibiotics. We will give nebulizer treatments. We do wound care. I mean, because all these, so hospice really is a specialty. There's end of life care I can tell you, I've been doing this for about the last 12 years. Before that, I didn't know some of the medicines that we deal with. It's really a specialty. So there's symptoms that we see across the board with a lot of patients, but those are symptoms that another nurse maybe working in the hospital would probably never see. So I think our biggest plus for our families is education, what to expect, what the decline looks like. And answering those questions that they probably feel like they're all alone. I'm the only one that's ever had this happen to my mom or my spouse. And we all know that, it's sad, but there's millions of people out there dealing with that every day.
Yeah, that's a common thing when we're isolated as ourselves for family caregiver, and it's tough to get out. And there's a lot of guilt associated. If I ask a question I don't know, does it look like I'm not doing a good job, or I don't know what I'm doing, or I must be the only one who's struggling with this? And
absolutely, people always feel guilty too, like, am I giving up? And so what I tell them, have you ever talked to your loved one? Did they say, if I was in this position, what do I want to do? And they said, families tell me that all the time. They say, oh yeah, mom said she would never want to live like this, or never. I said, so at 92, your mom's 92, why would you want to put her through so much aggressive treatment if she said she wouldn't want this? And they're like, I never thought about that. I said, well, having that conversation with families early is important, so we know your wishes, and then all we're doing is honoring those wishes.
Yeah, because so much of our society and our medical world is we can fix things, everything we can fix. And sometimes fixing it means allowing life to happen without the strong medical interventions, but the other interventions that you refer to, the chaplain, the nursing care, the comfort care, preparing the family, and things along those lines that sometimes get looked at as not such important parts of it, but are certainly key to
very much
family.
So.
I mean, just without that, families are really left on their own, and who knows how to manage that on their own.
Or what to expect. I think the unknown is so scary. I've actually sat down with families and I said, okay, this is where we're at today. And our day can change completely to something else tomorrow. And so we kind of sit down and go over, when we do the consultation, of what the journey may look like, some things that may happen. So when they do happen, they're not afraid. And they know that this was expected, or that the nurses, as they see things changing, they say, okay, we're at this stage now. This is what we're expecting. And so they're not they're not clueless on what's happening, because the unknown is so scary for
Mhm.
everybody.
Oh, absolutely. Yeah, when you know, you could do better when you know.
Right.
Yeah. Okay. So hospice is covered by Medicare. Hospice care is covered by Medicare. It doesn't mean all care is stopped. It
That
means
is
there's
correct.
an addition of care, and it also has to do with what the hospice diagnosis is as well, right? So what is the
Exactly.
diagnosis? So for our audience, a lot would be dementia. So dementia care. So let's say if they've got chronic lung disease as well, and dementia, the chronic lung disease can continue to be managed and treated in comfort, with all humanity and all, right? Because that's one thing I hear too. It's like, oh, we're just gonna kind of let people suffer, and I'm like, oh my gosh, it's like the
Oh my
opposite
gosh,
of
no.
that. It's the opposite of that piece
We're
of
all
it.
about symptom management and
Mm-hmm,
comfort care.
mm-hmm,
So we're not out to do new diagnoses like CAT scans and MRIs and things like that, but we're going to manage all those symptoms. If you're nauseated, we can give you something for nausea. If you get a cold or if you get pneumonia, we see that sometimes, we're going to give you antibiotics. We're going to give you nebulizer treatments. Do you need oxygen? We'll give you oxygen.
mm-hmm.
All of those things. If you get a sore, we'll do wound care. Now, if something happens that's not related to your hospice diagnosis, you can still get care for those things. If you need to go to the dentist, you need to go to the eye doctor. If you need to see the podiatrist, those are the things that we see most of. They can still do that because that is not related to their main hospice diagnosis. Does that make sense there?
Yeah, and I can see why that's confusing for people. Because hospice sounds like this all umbrellaing, like when you're in hospice, that's it. Everything is under that umbrella and everything else stops. And it doesn't have to. It can,
That's correct.
for some of that, it can for some, so long as the symptoms are managed and the comfort level is there. But it doesn't mean that you can't go on and take care of the other things that are important.
Exactly. And people often, one of the things that I hear from my families is, oh, do we have to stop their blood pressure medicines? Absolutely not. We're not here to make things happen faster. We're here to give them the best life possible. So in other words, we want to make sure they're taking their diabetes medicine, their hypertension medicines, or whatever but we're here to help control the pain, can make sure their breathing's okay, and any other symptom. And when you brought up the chaplain, that's anxiety. Is one of our biggest symptoms. So we also bring in for counseling with the social worker or the chaplain. We also may have to give them medication for that nervousness because they're going through a lot of changes.
Yeah, and what a two things. So one thing I want to say, what a tough time when you're perhaps for those with dementia, they may not be able to verbalize what they're feeling or whatever, but it comes out in behaviors. And sometimes just someone being there present, that they can just be, because, and people I've spoken to who have been able to express themselves will say, my family's with me. I don't want to say how I really feel because this is really hard. And they're going through enough as it is. And some people I've cared for with dementia, I've thought to myself, I think that's what they're feeling, but can't say it per se. But when someone else is there, it's like, okay, now I can just, I'm not worried about hurting my daughter's feelings or what have you by saying or making their situation more challenging, and let's say, and I just have to think that happens whether people are able to say it or not. Yeah.
They'll open up to I don't want to say a stranger because we become like family to them. They get used to seeing the same faces over and over.
Right.
And they'll open up to us, but they don't want their families to feel like they're not trying hard enough or that they're a burden on their family. So they sometimes can't deal with all those emotions, can't express it to their family. And our chaplain is wonderful about coming in, or social worker, or even then sometimes we line them up with other people to talk with. Hospice has volunteers also. Somebody to just come read for a little while or listen to music. We try to find out what interests that patient and
Yeah.
connect with them.
I have a friend with therapy dog who visits.
Oh,
Yeah, and she works with hospice. It's in another state, but she works with hospice, and she goes in with her dogs, who are very large poodles that,
oh, how
really,
fun.
yeah, yeah, and they're very gentle, and it just seems to be a very comforting thing for a lot of people. And, there's one thing I know we've talked about our three. There's one you touched on, and I wanted to say it one more time, and that when hospice starts, which you had said, it doesn't mean we hurry the death along. And that has been one thing I have heard too, is a
Oh my
myth.
goodness,
Once we
yes.
start hospice just kind of hurries things along, right? I'm like, yeah, no, that's not.
That, you know what, the morphine, I hear that all the time. And I tell people, I said, don't be afraid of the morphine is not here to, it's really not that great for pain. We use it more for breathing. People that have a lot of respiratory problems, and it stays in your system just very short time. But once the family gets over that hurdle of thinking, oh my gosh, we're going to give them morphine and then they're going to die, they realize it's a very useful tool. And not all of our patients even use it. It's a tool there if you need it. But everybody feels like hospice is going to come in, and once the morphine starts, that's it. And so I think, years ago, hospice was different. And it's evolved now, and it actually is specialty of care. And I can tell you 9 times out of 10, when I have a family that's very reluctant, once they're on a week or two, they're like, I don't know why we waited. This has been a lifesaver. Not only that, just for some mental health. And one of the biggest benefits of hospice is the respite care. Are you familiar with respite care?
Let's talk about that, because that's an important thing.
Right. So one of the benefits is that the caregiver, studies show that caregiver burnout is a huge problem. And oftentimes the caregiver is not taking care of themselves, and they are just exhausted. And sometimes they start having issues as well as the patient.
Yeah.
So hospice will pay for 5 midnights in a nursing facility to give that caregiver a break, because it is all consuming. And I always tell family, it takes a village. It takes, other family members, plus use the respite care, kind of recharge your batteries. Or let's say you have a graduation or a wedding and there's no way you can go because you can't leave your loved one, but hospice can put them there in a skilled nursing facility where he could get care for those 5 midnights. And the reason why I say 5 midnights is because whether you go in at 9 o'clock in the morning or 10 o'clock at night, once midnight strikes, that's your first day. So that's why I don't like to say 5 days, because it's a little misleading.
I see. Yeah, I think that's a real key thing. And it's often a very tough thing for caregivers there's just so much guilt. So I'm like, well, if they're not with me and I'm not, then, well, what if the worst happens and I'm not there? And what if then am I negligent for not being there, and all these things, which is just part of why I think that it takes a village, and the other people on the team are so, so important. And I'll tell you just a brief story. I had one of my patients came into the clinic with her husband, and she was probably mild, moderate, but early onset. So she was in her 50s.
Very aggressive.
And they had spoken with people who, it wasn't so much for her, but it had a decline, and she knew it was happening. So she was at the phase where she knew what was happening, but it was just so distraught and worried for her husband about how he was going to care for her. And they had gone to a meeting or something. Someone was talking about hospice, and she heard about it, and they hadn't been able to stop crying since, and then came into the office, had an emergency appointment, and it took a little bit to even say it. And she said, I want this for my husband when I'm ready for it. And I want to be sure that I help him choose, because he's worried about choosing the right
Oh,
people, the right team. That's why they were so upset. She was, I want, and I don't think you're going to let me do that because I'm not ready for hospice yet. And so I just pulled my phone out of my lab coat. I'm like, hold on, I have a couple numbers on speed dial right here. We can make you an appointment and they'll come by and talk to you at home and explain things. And that there was no problem in doing that. And it was just like the ray of sunshine had, and the
absolutely.
relief for her to know that he wouldn't have to be doing that difficult time of their lives by himself. And she said, I'm not going to be there to help him like I'm going to want to.
Oh
And
my
that was,
gosh, that gave me
yeah,
goosebumps. With
honestly, that was probably, it was like this epiphany for me then. I'm like, I got to tell these stories. And that was like where the
absolutely.
wheels got turning to write a book. But a lot of that was around hospice care and how we care for those we love. And, getting that information. I think dementia care is even a whole different ball game, if you will, a specialty and within a specialty.
That's
And
right.
when you said it's evolved, I just wanted to go, yes, yes, it is evolved even in the last 10 years that I know
I would
of.
absolutely agree with that.
Mhm,
And it's something that doctors are not always comfortable bringing up because they
mhm,
feel like the families might be angry because they say, wait, isn't there any hope? Well, of course, there's always hope, but we want people to know that that's an option. You
mhm,
know,
mhm.
it
And
is
they know
there,
about the myths, I
right?
personally knew about the myths too, and talking to families. I'm like, okay, here we go. This is going to be a tough one because,
Yeah. I
the,
encourage people to, and with some earlier, because oftentimes people wait till it's the last couple of months of life. And really, we could have been helping them 6, 8 months ago.
mhm,
So when we look for signs and symptoms that kind of give us those red flags that, hey, they might meet the criteria.
mhm,
So some of them, some things that we want to look for are like loss of weight, loss of function, having problems speaking. I'm talking about for dementia.
uh-huh,
And for, let's see, we talked about swallowing, bowel and bladder loss, different
mhm,
things like that. So when we start seeing some of those things, it's a good time to talk,
mhm.
interview a few companies
Yeah.
and ask them good questions. And you'll want to ask, how often do you come?
Mhm,
Most hospices come once or twice a week,
mhm,
but they're on call 24/7. So I don't care if it's 2 o'clock in the morning or 3 o'clock Sunday afternoon. If you have a question, they'll be there to answer it or even come by should you feel I'd like y'all to come see mom. She's not looking the same or something's
mhm.
different.
Right.
So I mean, you can't get a hold of a doctor on a Sunday afternoon or 2 in the morning to make a house call. So that's
Right. And
a great service.
right. Yes. And the great questions to ask. So, what is the team like? How often do they
Mhm.
visit? What's the on-call like? And is the respite, and do you have that respite option within your company? And that it's something that's given for hospice, we know, but it's also something to say, I know about it and I may want to use that. You want to
Yeah,
be
and
sure they're
ask where.
informed too.
Who are you contracted with?
Mm-hmm.
Because I've known oftentimes somebody will ask, I said, where are you interested? Because oftentimes we can go out to that facility.
Mm-hmm.
Say the children live in Austin and they'd rather have their mom closer.
Mm-hmm.
So then we could go out to that facility and make a contract with them for that stay.
Mm-hmm.
So oftentimes you want to ask, where are those facilities? Are you available to use respite here? And what all equipment can I get? Because most companies will give, your bed, your shower chair, your wheelchair, oxygen, of course, the briefs and the wipes. How often will you be sending a
Yeah.
nursing assistant?
Right, to help with it for the people I used to do house calls for and things, to have someone come in to help with the bathing and personal
Oh,
care.
huge
It's
help.
like, oh, well, and like, yes, but that allows you to be a wife and not the bather. You can love your husband without doing all the time being the direct care, or your father or your mother, and it allows you to just be daughter or just be son, and that's a beautiful gift. And
You know,
yeah, I
the
have.
other thing I wanted to mention real quick is a lot of people think you have to be bedbound to be on hospice. That couldn't be further from the truth. We have people that travel to other parts of the state or even the country, and what we do is we assign them with the hospice in that area just for emergencies. That way they'd have a nurse to come see them. That's a great benefit of hospice too, because I had a lady not too long ago that wanted to see a concert in San Diego. So we did set it up. She went with her daughters and we set them up with a local hospice there just in case she had any emergency needs. And then, of course, she came back and she was thrilled. So by no means do you need to be bedbound or um, that's just
Wow. Thank
another
you.
one of those myths.
Thank you for saying that. That wasn't something I would have ever thought about, but it's really important. Okay, so I want to close with this then. So Yoli, I'm a family member. I'm thinking maybe it's time for hospice, but the doctor hasn't really mentioned it. I don't really know. Who do I talk to about that? Who is the
You
one who makes the referrals, or who's going to help me get an evaluation for hospice to see
okay?
if it is appropriate? What do I do?
You can call any hospice company. You don't need a doctor's order to have that consultation. So somebody like myself would go out and explain what hospice is. Then we would go to your doctor and ask him, what do you think? Do you think that this is something is appropriate for your patient? The doctor, if he agrees, will write the order. And it's as simple as that.
Mm-hmm. So the doctors need to write an order, but I can talk to hospice on my own if
That's
that's what I want
correct.
to do. Okay, and if I go to see my doctor, then they would make the call. They would look for hospice possibly. That's another
They
option.
could do that too.
Hmm.
They could call a lot of the just say, doctor, I'm interested in this. He could make suggest a couple of companies that maybe he works with.
Hmm.
And I strongly encourage everybody, interview a couple of companies, and go with your gut, pick what feels right for you.
Hmm.
Now, having
Yeah.
said that, if you get on a company, you say, you know what? I'm not so sure about this. You're always free to transfer companies
Hmm.
and you're always free to revoke, meaning I've changed my mind. It's not set in stone. You're allowed to do that too.
Good to know. What great tips. Thank you so much.
You're welcome.
Yeah, I feel so grateful that you've shared these tips that are so user-friendly, things that people can hear and take right now and know what to do and what to ask. That's so empowering at a time when you might feel like I'm in a world I don't know anything about. Where do you
Ex-
begin? Hmm.
exactly. And
Yeah.
we're here to help and serve. And I think, people should just get the information about and then make their decision.
Right, right. All right. Well, the contact information will be there, and we'll have some other resources as well. And these tips also, because this ends up becoming a blog too. So you can find this information all over the place. And, it's our mission for Doggies for Dementia that, we're here to educate and empower and to help families navigate really tough times. And dementia and hospice, as I said, as we were talking about, it's really it's a specialty within a specialty, and it's come a
Absolutely.
long way. We could say that. I can say that myself in the last 10 years, and even as a clinician, who I would have referred and when I would have referred to hospice changed from 10 years ago to 5 years ago. Even
Absolutely.
we've come a long way.
Well, thanks again for having me. I love that we're
Thank
getting
you.
that information out to people that may not know that that was even an option.
So important. And thank you all for listening to Experts Dig In with Doggies for Dementia, and we'll see you next week. Take care. Bye-bye.